This is a video tutorial on image segmentation for the MEC Educational Challenge. I'm Ramesh Sridharan from CSAIL at MIT. First, what is image segmentation? Roughly, it's the process of separating different regions of an image. For example, in this CT of the chest, we may be interested in separating the lungs, which I'm roughly outlining in green, from the background. We'll call these voxels here lung, and we'll call these voxels here background. This is a simple segmentation. We may also want to do more interesting things than just segmenting foreground from background. For example, in this MRI of the brain, we may be interested in separating the gray matter from the white matter from the cerebrospinal fluid, or CSF, which is here inside the ventricles and outside the brain. In fact, I'm showing you now a manual segmentation that marks exactly these different components. Another common application is segmenting pathologies in images. For example, this MRI of the brain shows a tumor, some affected tissue here, as well as healthy tissue. We see that this is a particularly challenging case, A, because the tumor has the pathology has two regions, and B, because the intensities of the tumor are pretty similar to intensities of healthy tissue over here. So anything based purely on intensities, like thresholding, simply won't work in this case, partially because of noise in the image, partially because the intensities don't match, and partially because of effects like these over here. This is a challenging case of image segmentation that exemplifies the need for sophisticated methods and algorithms. So, why do we care about image segmentation? Well, it can be useful clinically just by itself. That is, a clinician can often gain valuable insight about a patient, about an image, about a case, just by looking at a segmentation. It can also be useful in planning interventions. Knowing where a tumor is can help guide a surgery and help doctors avoid areas that should or shouldn't be affected. It's also useful for quantitative analysis. A segmentation can provide information on volume and shape of the underlying structure that's being segmented. This in turn can be used to analyze the population or provide patient-specific classification and diagnosis. Of course, these are just a few of the reasons that segmentation is useful. There are many more applications, each of